All right, the upcoming Summer Olympics, they are set to commence in just less than 50 days, but things remain far from certain. Although the IOC says that they are moving forward with the event, a senior member recently saying that the games will take place barring an Armageddon, and there have also been protests and calls to cancel the Olympics outright over the ongoing COVID pandemic in the host country of Japan. Well, joining me now is Tara Kirk Sell, senior scholar at Johns Hopkins Center for Health Security, who also, by chance, won a silver medal for swimming at the 2004 Olympics. Tara, it's great to have you with me today. Now, you say that these games should go on as planned. Why is that?
Yeah, well, we've come a long way since the Olympics were postponed a year ago. We've learned a lot about how to prevent transmission. We've learned how to contact trace, how to make sure that we can control the disease when we find it, how to test for it. I mean, we also have a very good vaccine. So given all those gains, I think that it's possible to conduct the Olympics safely and see how we can move forward out of the pandemic.
And you have this unique perspective because you're a former Olympic athlete who made podium, and at the same time, you're now a health scholar as well. It's interesting, 83%, I'm reading here, of participants in a local poll saying that the Olympics should actually be postponed or canceled. Now, from your perspective, what's the best way to see this through? Obviously, vaccinations will be in focus, testing will be in focus as well. I'm just curious if there's a protocol that you would advise in terms of holding these games.
Yeah, there are a number of things that can be done, and they are planned for in the Tokyo Olympic playbook to test these athletes very frequently to make sure that they don't have an outbreak that gets out of control. Obviously, as many of them need to be vaccinated as possible. I think, though, when people imagine the Olympics, they imagine this, uncontrolled revelry, when in fact it really is a very controlled event. And I think that really helps us be able to prevent anything from getting out of control.
Mm-hmm. Olympic organizers saying about 10,000 volunteers for the Tokyo Olympics have quit. What is the role of Japan here, not just the athletes, not just the IOC, to ensure that this is safe?
Yeah, so Japan is going to have to be part of this process. It's not just the IOC. And so, I think it is important to take into account some of the hesitations. A lot of the work that I do in public health preparedness and planning for these pandemics is thinking through how to best communicate. And I clearly think that there's a problem here with communication and making sure that people understand the things that are in place to make sure it will happen safely. Obviously, with a number of volunteers stepping aside, I think that it's going to be important that there is enough staff there to conduct the games, but let's also remember that there have taken a lot of the foreign fans are not going to be able to attend, so that takes a lot of the pressure off the volunteers.
Tara, I do want to get your take because you are a former Olympic athlete and winner. What would you say to some of these athletes who are preparing to travel, who might have questions of their own? Put us in their shoes.
Well, right now, I think that there are a lot of athletes who are thinking about heading to the Olympics, but there's still, for many of them, still the trials to get through. So I think a lot of them are just saying, I'm going to concentrate on the trials. I'm going to assume that things are going to go forward. We still have track and field trials. We still have swimming trials coming up. So they'll be naming their Olympic team soon. And the athletes themselves are probably just trying to put blinders on and move forward and try to, make the team. And after that, I think it will be really important that they sort of follow those requirements that are going to be put on them to have a safe games. When I swam in the games, we came back from the closing ceremonies and everyone came to the dining hall and we had this giant sort of dance party to Greek music. And probably that's not going to be something that can happen during this Olympics. And we'll need to make sure that we have athlete buy-in on that.
I think a lot of people would like to celebrate that way, yes. So maybe a delayed celebration with a dance party down the road. I'm just curious, Tara, we know that basically foreign fans who would want to travel otherwise to Japan won't be able to do so for this Olympics. Does that make it any safer? Does that change the needle at all?
Having fewer foreign fans makes it so that we have a smaller gathering, a more controlled gathering. When I talk to people about having sports events, the thing that it's easier to do is have the sports event itself. The fans are obviously, an add-on bonus. And in this case, I think, it is helpful to have fewer fans because then we just have less mixing.
Mm-hmm. Now, false positives, delayed results when it comes to testing, that might be something that impacts the process here. And I feel for those athletes, right? They missed it last summer. You train so you peak at the very right time, especially if you're a swimmer and many of the other athletes as well. How do you think these teams and these athletes adapt to that, right? That it's still kind of a fluid situation.
Right. Well, so, the public health side of me wants to make sure that we catch all the cases. The athlete side of me wants to make sure that we don't have athletes missing out needlessly. And so one of the things that I think is going to be really important, all these athletes have to drug test, and all the drug testing takes an A and a B sample. And so I think with a COVID test, it's just as consequential now as a drug test, because it can take you out of competition. So we also need to see A and B samples so that we don't have someone waiting for a confirmatory test while their event's going on and they miss their event, and then they do a confirmatory test and they find out that it was a false positive.
Okay, so 49 days out. Yesterday we were officially 50 days out. Today it's 49. So for the athletes who are still training, what are the best practices to make sure that they stay safe? 7 more weeks to make sure that they can perform. What would you tell them?
I would tell them to get vaccinated. Get vaccinated as soon as possible. This is going to be your number one protection against getting COVID, against having some bad outcome, both from a health outcome and also from missing the games. You may have to take a day off after your vaccine if you have a sore arm or something, but it's well worth it. And we know from the clinical trials, from all the safety monitoring, that the vaccine is safe and incredibly effective.
All right, Tara Sell, senior scholar at Johns Hopkins Center for Health Security, as well as a silver medalist in the 2004 Olympics. Great to have Tara with us.